Hey, Alpha Nurses and Licensure from alphanursguide.com. This is 20 practice questions. Without delay, let's get started.
When teaching the client to care for an ileal conduit, the nurse instructs the client to empty the appliance frequently. Which of the following indicates that the client is following instructions? 1. The skin around the stoma is red. 2. The urine is deep yellow. 3. There is no odor present. 4. The seal around the stoma is intact. The correct answer is 4. The seal around the stoma is intact. If the appliance becomes too full, it is likely to pull away from the skin completely or to leak urine onto the skin. Thus, if the seal is intact, the client is emptying the appliance regularly. The skin around the seal should not be red or irritated, which could indicate a leak. There will likely be an odor from the urine. Deep yellow urine indicates that the client should be increasing fluid intake. A client has undergone a cystectomy and an ileal conduit diversion. What should the nurse incorporate into the discharge instructions? Select all that apply. 1. Drink at least 3,000 milliliters of fluid each day. 2. Minimize daily activities. 3. Keep urine alkaline to prevent urinary tract infections. 4. Avoid odor-producing foods, such as onions, fish, eggs, and cheese. 5. Wear snug clothing over the stoma to encourage urine flow into the drainage bag. The correct answers are 1. Drink at least 3,000 milliliters of fluid each day, and 4. Avoid odor-producing foods, such as onions, fish, eggs, and cheese. An adequate fluid intake aids in the prevention of urinary calculi and infection. Odor-producing foods can produce offensive odors that may impact the client's lifestyle and relationships. Lack of activity leads to urinary stasis, which promotes urinary calculi development and infection. Acidic urine helps prevent urinary tract infections. Tight clothing over the stoma obstructs blood circulation and urine flow. The nurse evaluates the effectiveness of the client's post-operative plan of care. Which of the following would be an expected outcome for a client with an ileal conduit? 1. The client verbalizes the understanding that physical activity must be curtailed. 2. The client will place an aspirin in the drainage pouch to help control odor. 3. The client demonstrates how to catheterize the stoma. 4. The client will empty the drainage pouch frequently throughout the day. The correct answer is 4. The client will empty the drainage pouch frequently throughout the day. It is important that the client empty the drainage pouch throughout the day to decrease the risk of leakage. The client does not normally need to curtail physical activity. Aspirin should never be placed in a pouch because aspirin can irritate or ulcerate the stoma. The client does not catheterize an ileal conduit stoma. A nurse is caring for a client with an ileal conduit. When assessing the stoma, which of the following outcomes are not desirable? Select all that apply. 1. Dermatitis. 2. Bleeding. 3. Fungal infection. 4. Use of adhesive solvent on the skin around the stoma. 5. Placing skin cement on the faceplate of the collection bag. The correct answers are 1. Dermatitis, 2. Bleeding, and 3. Fungal infection. Dermatitis with alkaline encrustations may occur when alkaline urine comes in contact with exposed skin. Yeast infections, or fungal infections, are another common peristomal skin problem. If the stoma is irritated from rubbing, there will be bleeding. The nurse and client should avoid irritating the stoma. Adhesive solvent should be used on a gauze pad to remove old adhesive and should, therefore, not contact the stoma directly. Only a minimal amount of skin cement is applied to the faceplate of the collection bag and skin to secure the appliance over the stoma, so obstruction of the stoma by the cement would not be possible if correct technique is followed. The nurse should teach the client with an ileal conduit to prevent urine leakage when changing the appliance by using which of the following procedures? 1. Insert a gauze wick into the stoma. 2. Close the opening temporarily with a cellophane seal. 3. Suction the stoma before changing the appliance. 4. Avoid oral fluids for several hours before changing the appliance. The correct answer is 1. Insert a gauze wick into the stoma. Inserting a gauze wick into the stoma helps prevent urine leakage when changing the appliance. The stoma should not be sealed or suctioned. Oral fluids do not need to be avoided. A nurse is planning care for a client who underwent a percutaneous needle biopsy of the kidney. What should the nurse plan to do immediately after the biopsy? Select all that apply. 1. Assess the biopsy site. 2. Take vital signs every hour. 3. Assess urine for hematuria. 4. Place the client in a prone position. 5. Assess the client for chest pain. The correct answers are 1. Assess the biopsy site. 3. Assess urine for hematuria. And 4. Place the client in a prone position. The nurse should assess the biopsy site for bleeding and hematoma formation. The client should remain prone for 8 to 24 hours after the biopsy. A pressure dressing will aid in blood coagulation. Vital signs assessment should be taken every 5 to 15 minutes for the first hour, and then less often if the client is stable. The urine does not need to be collected and kept on ice. The nurse should collect serial urine specimens to assess for hematuria. A renal biopsy does not put the client at increased risk for chest pain. A client is admitted to the recovery room after cystoscopy with biopsy. Before the nurse can discharge the client, the nurse should be sure the client 1. Has a bowel movement. 2. Has received the first dose of pain medication. 3. Has voided. 4. Has no blood in the urine. The correct answer is 3. Has voided. The nurse should verify that the client has voided prior to discharge in order to evaluate bladder function. Bowel function is not expected to be affected by this procedure. There may not be a need for pain medication immediately post-procedure and before discharge, but the nurse should assess the client's pain status and inform the client about the use and side effects of the medication. It is normal for the client to have hematuria because of the procedure. The client with an ileal conduit will be using a reusable appliance at home. The nurse should teach the client to clean the appliance routinely with which product? 1. Baking soda. 2. Soap. 3. Hydrogen peroxide. 4. Alcohol. The correct answer is 2. Soap. A reusable appliance should be routinely cleaned with soap and water. The nurse should assess the client with bladder cancer for which of the following? 1. Suprapubic pain. 2. Dysuria. 3. Painless hematuria. 4. Urine retention. The correct answer is 3. Painless hematuria. Painless hematuria is the most common clinical finding in bladder cancer. Other symptoms include urinary frequency, dysuria, and urinary urgency, but these are not as common as hematuria. Suprapubic pain and urine retention do not occur in bladder cancer. The nurse is evaluating the discharge teaching for a client who has an ileal conduit. Which of the following statements indicates that the client has correctly understood the teaching? Select all that apply. 1. If I limit my fluid intake, I will not have to empty my ostomy pouch as often. 2. I can place an aspirin tablet in my pouch to decrease odor. 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it. 4. I must use a skin barrier to protect my skin from urine. 5. I should empty my ostomy pouch of urine when it is full. The correct answers are 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it. And 4. I must use a skin barrier to protect my skin from urine. The client with an ileal conduit must learn self-care activities related to care of the stoma and ostomy appliances. The client should be taught to increase fluid intake to about 3,000 milliliters per day and should not limit intake. Adequate fluid intake helps to flush mucus from the ileal conduit. The ostomy appliance should be changed approximately every 3 to 7 days and whenever a leak develops. A skin barrier is essential to protecting the skin from the irritation of the urine. Aspirin should not be used as a method of odor control because it can be an irritant to the stoma and lead to ulceration. The ostomy pouch should be emptied when it is 1/3 to 1/2 full to prevent the weight of the urine from pulling the appliance away from the skin. A client is to have a cystoscopy. Which of the following indicate that the client has developed a complication after the cystoscopy? 1. Dizziness. 2. Chills. 3. Pink-tinged urine. 4. Bladder spasms. The correct answer is 2. Chills. Chills could indicate the onset of acute infection that can progress to septic shock. Dizziness would not be an anticipated symptom after a cystoscopy. Pink-tinged urine and bladder spasms are common after cystoscopy. A client has an ileal conduit. Which of the following solutions will be useful to help control odor in the urine collecting bag after it has been cleaned? 1. Salt water. 2. Vinegar. 3. Ammonia. 4. Bleach. The correct answer is 2. Vinegar. A distilled vinegar solution acts as a good deodorizing agent after an appliance has been cleaned well with soap and water. If the client prefers, a commercial deodorizer may be used. Salt solution does not deodorize. Ammonia and bleaching agents may damage the appliance. If the client develops lower abdominal pain after a cystoscopy, the nurse should instruct the client to do which of the following? 1. Apply an ice pack to the pubic area. 2. Massage the abdomen gently. 3. Ambulate as much as possible. 4. Sit in a tub of warm water. The correct answer is 4. Sit in a tub of warm water. Lower abdominal pain after a cystoscopy is frequently caused by bladder spasms. Warm water can help relax muscles. Ice is not effective in relieving spasms. Massage and ambulation may increase bladder irritability. A female client who has a urinary diversion tells the nurse, "This urinary pouch is embarrassing. Everyone will know that I'm not normal. I don't see how I can go out in public anymore." The most appropriate nursing goal for this client is to 1. Manage her anxiety about her health. 2. Learn how to care for the urinary diversion. 3. Overcome feelings of worthlessness. 4. Express fears about the urinary diversion. The correct answer is 4. Express fears about the urinary diversion. It is normal for clients to express fears and concerns about the body changes associated with a urinary diversion. Allowing the client time to verbalize concerns in a supportive environment and suggesting that she discuss these concerns with people who have successfully adjusted to ostomy surgery can help her begin coping with these changes in a positive manner. Although the client may be anxious about this situation and may be feeling worthless, the underlying problem is a disturbance in body image. There are no data to indicate that the client does not know how to care for the urinary diversion. A client who has been diagnosed with bladder cancer is scheduled for an ileal conduit. Preoperatively, the nurse reinforces the client's understanding of the surgical procedure by explaining that an ileal conduit 1. Is a temporary procedure that can be reversed later. 2. Diverts urine into the sigmoid colon, where it is expelled through the rectum. 3. Conveys urine from the ureters to a stoma opening on the abdomen. 4. Creates an opening in the bladder that allows urine to drain into an external pouch. The correct answer is 3. Conveys urine from the ureters to a stoma opening on the abdomen. An ileal conduit is a permanent urinary diversion in which a portion of the ileum is surgically resected and one end of the segment is closed. The ureters are surgically attached to this segment of the ileum, and the open end of the ileum is brought to the skin surface on the abdomen to form the stoma. The client must wear a pouch to collect the urine that continually flows through the conduit. The bladder is removed during the surgical procedure, and the ileal conduit is not reversible. Diversion of urine to the sigmoid colon is called a ureterosigmoidostomy. An opening in the bladder that allows urine to drain externally is called a cystostomy. The nurse teaches the client with urinary diversion to attach the appliance to a standard urine collection bag at night. The most important reason for doing this is to prevent 1. Urine reflux into the stoma. 2. Appliance separation. 3. Urine leakage. 4. The need to restrict fluids. The correct answer is 1. Urine reflux into the stoma. The most important reason for attaching the appliance to a standard urine collection bag at night is to prevent urine reflux into the stoma and ureters, which can result in infection. Use of a standard collection bag also keeps the appliance from separating from the skin and helps prevent urine leakage from an overly full bag, but the primary purpose is to prevent reflux of urine. A client with urinary diversion should drink 2,000 to 3,000 milliliters of fluid each day. it would be inappropriate to suggest decreasing fluid intake. After surgery for an ileal conduit, the nurse should closely assess the client for the occurrence of which of the following complications related to pelvic surgery? 1. Peritonitis. 2. Thrombophlebitis. 3. Husitis. 4. Inguinal hernia. The correct answer is 2. Thrombophlebitis. After pelvic surgery, there is an increased chance of thrombophlebitis owing to the pelvic manipulation that can interfere with circulation and promote venous stasis. Peritonitis is a potential complication of any abdominal surgery, not just pelvic surgery. Husitis is most frequently an indication of liver disease. Inguinal hernia may be caused by an increase in intra-abdominal pressure or a congenital weakness of the abdominal wall. Ventral hernia occurs at the site of a previous abdominal incision. The nurse is teaching the client with an ileal conduit how to prevent a urinary tract infection. Which of the following measures would be most effective? 1. Avoid people with respiratory tract infections. 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. 3. Use sterile technique to change the appliance. 4. Irrigate the stoma daily. The correct answer is 2. Maintain a daily fluid intake of 2,000 to 3,000 milliliters. Maintaining a fluid intake of 2,000 to 3,000 milliliters per day is likely to be most effective in preventing urinary tract infection. A high fluid intake results in high urine output, which prevents urinary stasis and bacterial growth. Avoiding people with respiratory tract infections will not prevent urinary tract infections. Clean, not sterile, technique is used to change the appliance. An ileal conduit stoma is not irrigated. The nurse is assessing the urine of a client who has had an ileal conduit and notes that the urine is yellow with a moderate amount of mucus. Based on these data, the nurse should 1. Change the appliance bag. 2. Notify the physician. 3. Obtain a urine specimen for culture. 4. Encourage a high fluid intake. The correct answer is 4. Encourage a high fluid intake. Mucus is secreted by the intestinal segment used to create the conduit and is a normal occurrence. The client should be encouraged to maintain a large fluid intake to help flush the mucus out of the conduit. Because mucus in the urine is expected, it is not necessary to change the appliance bag or to notify the physician. The mucus is not an indication of an infection, so a urine culture is not necessary. A client is scheduled to undergo weekly intravesical chemotherapy for bladder cancer for the next 8 weeks. Which of the following indicates that the client understands how to manage the urine as a biohazard? The client will 1. Void into a bedpan and then empty the urine into the toilet. 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. 3. Clean the bathroom daily with disinfectant wipes. 4. Use a separate bathroom from the rest of the family for the next 8 weeks. The correct answer is 2. Disinfect the urine and toilet with bleach for 6 hours following a treatment. After intravesical chemotherapy, the client must treat the urine as a biohazard. This involves disinfecting the urine and the toilet with household bleach for 6 hours following a treatment. It is not necessary to use a bedpan and then empty the urine in the toilet. The client can use the toilet, but must disinfect the urine with bleach. The bathroom does not need to be cleaned daily with disinfectant wipes. The client does not need to use a separate bathroom as long as the client's urine is disinfected with bleach.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.